Hey, what's up, everybody? Welcome back to the Dude Nurse Show. Been away for a little bit, tied up with the holidays, doing this, that, and the other, but I'm back. I know y'all miss me. Got some great things in store for 2019, so stay tuned for that. Appreciate all the support on the channel. Thank you, thank you, thank you, thank you, thank you. So the other day, I was watching a show called Mythbusters, and I always loved that show. It was so ingenious, the stuff that they would test, and it was just really cool to see them build stuff and construct stuff, and utilize help from specialists and all kinds of really crazy crap. Anyway, it kind of got me thinking about myths that I see perpetrated in healthcare. Like one of the common themes that they talk about is myths perpetrated in Hollywood, and so I thought, let me do a show about myths in healthcare, some of the most common ones that I see. So without further ado, let's go ahead and dive right in. That really wasn't a diving sound. I don't know why the hell I did that, but anyway. So working in the ER, one of the most common things that I hear when a patient comes in, oftentimes we don't have a medical history on them. Never seen them before in my life. They've never been to never been to my hospital, never been in my ER. So we take a medical history. So one of the first questions we ask them about allergies and whatnot, but we come to a question: do you have any medical problems? Past medical history, and they say no medical problems. And even in a young person, okay. But if this person's, 60, 70, I kind of find it a little hard to believe that they don't have any medical problems, never had any medical problems. So I say, okay, all right, no medical problems. Next question is, do you take any medications? And oh yeah, here's my list. And it, looks like War and Peace. It's so freaking long. And I'm looking at all this shit that they're taking, and I'm going, so I thought you didn't have any medical problems. Well, I don't. And I'm thinking to myself, okay, something's not jiving here. Okay, I'm missing something. And I say, what do you mean you don't have any medical problems? And the myth is that patients often think because they're taking these medications that they don't have the illness anymore. It's cured. It's being treated, so therefore it's not relevant. And folks, got to tell you, that's just not the case. If you're taking metformin for your diabetes, and you're taking metoprolol for your hypertension, and on and on and on and on, you still have these particular illnesses. Okay, they don't just go away. Now, that being said, you can come off of certain drugs, or the dose can be lowered way down. Sometimes we'll keep a dose on for something just because of you having another comorbidity, that it's just safer for us to keep you on that drug, but we'll really knock the dose down. But so what you can then say is, I have diabetes, but I control it with diet and exercise. Well, great. You might not necessarily need to take the medication anymore at all, but you still have the disease. I mean, diabetes, doesn't really go away. It can, like I said, it can be controlled with diet and exercise. And if you're a type 1 diabetic, you can have, a pancreas transplant, and that could maybe take care of it. But then you got a whole host of other shit to look forward to. But anyway, you get the point I'm trying to make. So, like I said, I can't tell you how many times I hear people say, no, I don't have any medical problems. You have no medical problems. Nope. And then they literally pull out bags and bags of medications, and I'm going, oh, ay Dios mío, here we go. And that happens all the time. So just because you are taking medication, it doesn't mean you don't have the disease. And furthermore, it doesn't mean that you don't need to tell us about it, okay? Because another little thing that we'll do, if you ever have to come back, we will oftentimes review. Actually, we should do it every time. Say, Mr. Jones, you were here 6 months ago, and at that time you were taking, lisinopril, hydrochlorothiazide, and metformin. Are you still taking those? Yes, I'm still taking those. Are you still on 10 milligrams and, whatever the case may be? So we will do medication reconciliation based off of what you were in there before. And, a lot of times when people have the multiple comorbidities, they'll see multiple providers. And so it's just kind of a way for us to make sure that we have everything, we have the full picture, okay? Because sometimes problems can absolutely be related to a medication. The dose could be too high, it could be too low, it's not therapeutic, whatever the case may be. So remember that next time you come into the ER, okay? Myth number 2, I still kind of want to talk about the ER. A lot of times when patients come in, we will, depending on the time of year, we will ask patients about their vaccination status. Same thing if they bring their little ones in. Did little Timmy get his childhood immunizations? Yes, no, okay. So a patient comes in and they say, have you had a flu shot this year? No, I haven't had a flu shot. Well, would you like one? We can give you one. And people say, oh no, I don't want the flu shot. I don't want it to give me the flu. And that's a common one. That's a very common one. And I'm not going to dive too much into vaccinations here because I'm going to do a separate show about vaccinations. But folks, trust me, if we gave the flu shot and it caused the flu, there would be a lot of dead motherfuckers, okay? The flu is the deadliest disease in human history. It's killed more people than smallpox, the plague, Ebola, I mean, you name it. Probably all of those put together. HIV. The flu is brutal, okay? And so sometimes people can have a reaction to an ingredient in the medication, one of the fillers or one of the delivering agents. We typically give a questionnaire, and if people have an egg allergy, if they have a compromised immune system, there's different types. We can give something called like an attenuated strain, on and on and on. I don't want to get too technical, but getting the flu shot does not cause the flu, okay? Like I said, people sometimes mistake feeling crappy for a couple of days because their arms really sore, they may run a slight temperature, but if you had the flu, you would know it. You would be sick. And like I said, we're giving these to everybody from the elderly to little kids. I forget exactly what the age is for little kids to have it, but my point is like I said, there would be a lot of dead mofos, okay? So getting the flu shot or any other vaccination, the pneumonia vaccination, you can get vaccinated, for tetanus. Getting a tetanus vaccination does not give you tetanus, okay? You would die for sure. Getting a rabies vaccination does not give you rabies. Those are rabies, tetanus, those are 100% fatal if they're not treated. So vaccinations don't cause the particular illness. Another thing, just real quick on the vaccinations, because we're talking about it, vaccinations don't cause autism or Asperger's or any of this other crazy nonsense that you hear all these Hollywood idiots. I say the Hollywood idiots. I think, what's her name? She was, I think, married to Jim Carrey. Now I think she's married to Donnie Wahlberg. I can't think of her name. It's not Jenny Garth. Anyway, one is that blonde-headed chick. They were campaigning. It's probably been 5 or 10 years ago now, but they were on this kick that these vaccinations caused all these other crazy diseases. And like I said, I'm not going to dive too much into it because I want to do another series about vaccinations. But suffice it to say, just to play devil's advocate, if a vaccination did cause autism or Asperger's or whatever, the reality is that Vaccinations are one of the most amazing inventions, in the last 100 years or so. I know technically, we believe it was Louis Pasteur that discovered the first smallpox vaccination. It was cowpox, and with the maidens, he noticed that they weren't getting smallpox, and on and on and on. Or was it Edward Jenner? Am I confusing myself? I think I am. I think that was Edward Jenner. Consequently, I have a glass of milk here, and I'm thinking about pasteurization. So completely disregard that. I'm not a complete idiot. Maybe a partial idiot. Never mind. We'll edit that out. But anyway, even if that were the case, the vaccinations, prevent I guess what I'm trying to say is the benefit far outweighs the risk. Okay, people will die for sure from smallpox. I mean, it was a very, very, very deadly disease. In fact, smallpox was said to be eradicated completely back in the 1980s. The World Health Organization declared it eradicated sometime in the 1980s, and ostensibly the virus only exists in a few freezers. There's a great book by, I think it was Richard Preston, called Demon in the Freezer, and that's about the smallpox vaccination. So if you guys feel so inclined, go check out. He's got a bunch of great books. I love his work. My favorite book by him, pardon my digression, was The Hot Zone, and that was what the movie Outbreak with Dustin Hoffman, Donald Sutherland, and Morgan Freeman, and Rene Russo, I believe, and Cuba Gooding Jr., and Kevin Spacey had a lot of great actors in it. It was based on that, and they had the fictitious Mutaba virus, and there's no such thing as the Mutaba virus, but it was an Ebola-like virus, a hemorrhagic fever virus. And anyways, an amazing book. So anyway, going back to topic. You guys know me, I stray off topic. Another myth that I just wanted to kind of touch on really, really quickly is about hospice. And again, I'm not going to dive too deep into the ins and outs of hospice because I'm saving that also for a later series. But I hear, when I worked in hospice, I always heard a lot of myths, and there's a lot of misinformation out there. And there's actually several that are related to hospice, but one of the main ones that we hear all the time is, we, as a clinician, we may make the suggestion to a family that, hey, Grandpa Bill, his cancer's not getting any better. It's time, we think, it may be a good idea to refer him to hospice care. And sometimes the family, they just look at you like, you're the biggest piece of shit. You want to kill Grandpa Bill. They think that by putting them on hospice, everyone in hospice is like Dr. Kevorkian, and that they go to hospice, and pretty much as soon as they sign the paper, we all but, stick a gun against their head and, blow their brains out, and, thanks for coming on hospice. That is not what hospice does. Hospice is a wonderful thing. It helps a great many people. It helps prevent a lot of suffering, needless suffering. We still have a long way to go, and I'm not going to get into a tangent about, death with dignity and physician-assisted suicide and euthanasia and all that kind of stuff, which I'm totally fine with. I think we need to decriminalize that. But again, like I said, I'm going to save that for another topic. But hospice is not a place that people go to be killed. Okay, it's just not what happens. People have been diagnosed with a terminal illness, which basically means that a physician has certified that he or she has a life-limiting illness with a prognosis of 6 months or less. And it's not like if the patient lives 181 days, 6 months and a day, that, they get kicked off hospice. I've seen patients on hospice for a year and a half, 2 years. Some people, sometimes their illness it takes a more slow decline as opposed to a more precipitous one. I've had patients come on hospice and, die before I could even get them admitted, get everything done. And it just kind of depends, but that's pretty much what it is, life-limiting illness. But doesn't mean that hospice, we don't treat, we don't do anything, but at the same time, hospice, we're not out there running every test. We're not sending people to the hospital constantly to get tests done, for their illness. Like if, let's say, for example, they're on hospice for colon cancer and they also happen to be a diabetic. They can go see their endocrinologist. They can go see their primary care physician. They just can't go see, an oncologist for their cancer. They can't go and get, chemo and radiation and all that stuff most of the time. There is something called, palliative radiation. You can do palliative chemotherapy to help alleviate pain. And, if you have tumors and things that are growing out of control, you can have some targeted radiation done and so on and so forth. But by and large, that's pretty much how it works. Okay. And so you can, once you, the other thing that I hear is, I'll die on hospice. I'm gonna die on hospice. There's a good chance of that, because again, a physician somewhere, somebody has certified that you have a terminal illness. Now, that doesn't mean that you can't come onto hospice and, after say a month, you can say, you know what, I've changed my mind. I want to fight this cancer. I want to, give it another try. I heard about this new drug, this new, drug trial, whatever. I want to try that. Great. All you got to do is sign a piece of paper and you're done. And then, 2 months into it, you say, you know what? This treatment sucks. I can't afford it. It's not working. It's making me feel worse. I want to get back on hospice. Sign some more paperwork. Come back on. It's pretty simple. It's not a huge, big, major thing that a lot of people think it is. It's like, it's not a roach motel. You check in, but you can't check out, kind of thing. People say that a lot. Another thing that I would always hear is that, part of the hospice interdisciplinary team, you typically have a nurses, you have an RN, maybe an LVN or an LPN, depending on what state you're in. In Texas, we call them LVNs. Social worker, chaplain, medical director, and a hospice aide. Okay, those are kind of part of your core team. The only people say, well, I'm not religious like myself. I'm an atheist. I don't want a chaplain coming to see me. Not gonna really do me any good. So you can decline the chaplain. You can decline the home health aide or the hospice aide. You can decline the social worker. But the only discipline that you cannot decline is the nurse. By the regulations by CMS, Center for Medicare Medicaid Services, which all other insurance companies kind of fall in line with. According to CMS guidelines, a registered nurse has to lay eyes on that patient and do an assessment at least once every 14 days. Usually by that 15th day, you're out of compliance, and then the patient should be discharged and possibly readmitted. We ran into that a few times. Sometimes people will say, yeah, I just don't want somebody out here all the time. Can you come every other week? Well, sometimes that can get a little fuzzy. So let's say you see them on, Monday the 1st, and then you got 14 days later, which would be, Monday the 15th, but they say, oh, I want to see you Friday this week. Well, you're, another 4 days past compliance. And so you'll have to be discharged. And that's not a common one that I would see, but sometimes people will say, well, I just want someone to come and, help clean me up, or, help me with some of my ADLs, activities of daily living, or, can you just send the volunteer, just need someone to talk to. we can, but you still have to be seen by that registered nurse. Okay. The last thing I'll say in closing about hospice is that hospice has an unlimited number of benefit periods. The first two benefit periods are 90 days each. Okay. So 90 and 90, that's where that 6 months come in. Okay. First two benefit periods, you must be certified by a physician, an MD or a DO. Okay. It may be slightly different in other states, like maybe Oregon or Washington. Other states, nurse practitioners have a little more autonomy than they do in Texas, but I still believe it has to be done by an MD or a DO. So after that, every subsequent benefit period is 60 days. So basically, before your benefit period is up, you will have to have what's called a face-to-face. That can be done by a nurse practitioner. I read somewhere in the regulations where they're talking about making it where PAs or physician assistants can kind of get involved, but by and large, never work with them in hospice. So that's kind of how that goes. And like I said, I've had patients, going into their, 9th and 10th and 12th benefit period, So like I said before, it's not like after, that 180th day, you're automatically booted off and, so on and so forth. So I hope you guys enjoyed this show. I hope it was informative as always. And like I said before, I'm going to go into a little more detail about a little more things about hospice and vaccinations and things in a later show. I'm actually putting some of the finishing touches on that now. But until next time, you guys be well. Happy New Year. Happy holidays. Stay safe. Dude Nurse, out.